The Africa Women Health Champions Initiative is surely an investment in the African woman and through her in the health of African people. So why did I start this initiative? I've been convinced for years that WHO, like many other organizations, needs far more women in leadership positions. My 2015 election as the first woman regional director for Africa was seen as historic and brought a wind of change to WHO in the African region. Immediately, I strongly pursued gender equity in WHO. I pushed for the presence of women in leadership positions. Simultaneously, I saw the need for a bottom-up approach with a vision to prepare women professionals early, becoming a pipeline for senior appointments. Through a partnership with the United Nations Volunteers Program, who I thank sincerely, I started the initiative in 2020. Over the past 3 years, it has attracted and placed 120 women health champions. Given the range of work that they do, the succession plan they represent, the benefits to themselves from mentorship to coaching and our geographical representation, the initiative has helped improve our work. This is an investment in the African woman. One of the greatest joys as I travel around the region is interacting with these dynamic, knowledgeable, and impactful young women. Looking back on the initiative, I am proud that I started it. First, we exceeded our target of 100 women health champions and reached 120 from 36 nationalities. These young women, aged between 22 and 35, contribute in 47 WHO country offices in Africa and in our regional office teams. There's no aspect of our work that they are not involved in. Many of them work in technical health areas, in communication, external relations, data management, and emergency preparedness. I'm impressed by their love for IT and social media in support of healthcare. Each time I meet them, in my office or elsewhere, I'm impressed by their stories. They tell me of how they're getting hands-on experience, of how they are strengthening national health systems or communities, and of how they are networking with leaders and peers. It is such a rich and successful experience. They are definitely contributing to the impact of our work. Some have transferred to positions in WHO in Africa and to other regions. I'm very proud that this experience is being emulated in WHO worldwide. I believe it's important for us to interpret this experience, learn from it, and innovate technologically and administratively. We should strengthen the focus on underserved communities and underrepresented countries, particularly the Portuguese-speaking countries. We should also promote more inclusion, bringing in more professional women with disabilities. Another area for improvement is to reinforce the orientation and induction of volunteers, as well as the continued briefing and guidance. We need to work in close partnerships with our other mentorship programs and explore leadership and team performance programs. We must support their keeping connected to each other, sharing experiences, supporting each other. We must also streamline the induction and administrative formalities and recruitment processes for more speed and agility. This is important in emergency settings where the lead time for deployment of personnel is often very short. I've one piece of advice to give the young professionals. While getting technical skills in the healthcare sector is very important, remember that people skills always make a difference. The ability to listen, empathize, communicate, both orally and in writing. Trust and emotional regulation define how we work in a team and what results we achieve. Find mentors within the organization and support each other.